Supporting self-management of long-term conditions. Supporting self-management involves providing information and encouragement to help people understand their condition, monitor symptoms, and take appropriate action. The Co-Creating Health programme is sponsored by the Health Foundation and has been delivered for 3 years by joint NHS Wandsworth services. There are 3 equally important factors that determine how much individuals are able and willing to play an active and effective role in managing their own health. The Self-Management Programme, SMP, for people with long-term conditions. A condition-specific programme for clients to build skills, tools and confidence to self-manage and working in partnership with healthcare professionals. The Advanced Development Programme, ADP, a training programme for clinicians, designed to develop and enhance skills in collaborative working and supporting clients to self-manage. Service Improvement Programme. This supports the co-creating health sites to change and improve the way their health services are designed and operated so that they better support self-management. As well as providing information, it is designed to build skills and the capability to ensure improvement lasts beyond the life of the programme.
The Advanced Development Programme consists of 6 hours of training, and we deliver that in 3 2-hour sessions, 1 each week, or we can deliver it in 2 3-hour sessions, depending on the needs of the clinicians attending. Each session focuses on a particular set of skills, which are really about how can a clinician maximise the time they've got. So if you've got a very brief consultation, or you've got a very long consultation, how can you make the best use of that time to help the person feel confident to start making changes in their behaviour that will have a positive impact on their health and well-being. And it's often assumed that if you're very short of time, it's much more effective simply to tell somebody why they need to change and how they need to change. But all of the evidence we have suggests that when people are struggling to feel confident about making changes and sustaining those changes, it's much more effective, even in brief consultations, it's much more effective to elicit from the individuals themselves why they might want to change and how they might want to make those changes. And so the training is about how can you build that into the routine contact that you have with the people you're working with.
It's absolutely amazing to be part, to train and coach healthcare professionals how to communicate and talk to service users to enable them to self-manage and also give them the space to talk about the important bits for them, helping them to set goals, helping them to problem solve. So it goes hand in hand. So I felt very privileged to be part of that, and healthcare professionals, they definitely have to help us to self-manage. So I felt really passionate about that.
What makes the Co-Creating Health programme different to other supporting self-management and self-management programmes is that it is actually quite a straightforward set of skills that are very easy to apply. And they're not only easy to apply, but they actually fit very snugly into everyday consultation and everyday interviews with patients that work really well. One can see also the quick response that one gets with individuals that you're consulting with.
It's made me much more confident in my interactions with professionals because I know what I want, and also I know how to put that across to them without undermining them and helping them to see that I'm not trying to challenge them, but I'm trying to get us to work more on a more even keel.
I found the course fantastic, one of the best courses I've ever done, ever, and came away with lots of thoughts, ideas, and it is an ongoing process to include some of these skills that I have learned, but it's remarkable the tangible difference when I can use some of these skills.
I think the unique aspect of Co-Creating Health, which is not done, I don't think, anywhere else, is that the training is co-delivered by both a healthcare professional and a lay tutor who has a lived experience of the condition. And both are experts in their field. You know, a GP is an expert in being a GP, and somebody with the conditions, you know, you're the expert of what does and doesn't work for you.
In terms of working with the clients using this approach, it facilitates that sort of partnership in working towards their goals. They feel respected, and it just facilitates better outcomes because we're working together to reach their goal.
When I first became involved with Co-Creating Health, while I believed in the principles of self-management and greater collaboration, I guess I felt I was already doing it a lot. So I was sceptical whether this could bring anything different to my practice. A lot of the structure is very familiar to a psychologist anyway. You do set an agenda with your client, you do focus on goals, and you do make plans to follow them up. So those concepts were not new to me, and so I was sceptical about, well, how much am I going to learn from this that I don't already know? And I think it's been quite a journey to realise that actually I didn't know as much as I thought I did when I came into the project.
It's a lot easier, I think, to let support someone in taking control of their lives, rather than trying to do it for them, rather than trying to solve things for them. It's very much like that old adage, you know, you can feed a person a day by giving them a fish, but if you want to feed them for life, you have to teach them and enable them to fish. And I feel it's very much like that.
I would just advise anyone who is at the point that they feel that they really want to take their own health care, as it were, by the scruff of the neck, to come and have a go at this. And for healthcare professionals, that it can really improve your relationship with the patient and take the burden off you, because the patient will actually take more control over their own life.
I think from the feedback that I've received from people, clinicians on the Advanced Development Programme, one of the main things that they say is that they feel much more positively about the impact it's had on their patients. So that when their patients come back, they say that they've been using some of the skills that the clinicians imparted to them. They see their patients less frequently, but when they do see them, there's been a marked improvement in that person's health. And also they feel much more in tune with the patient in terms of how they're feeling and what they can do to improve that, and less responsible for the patient's care. So it's much more of a joint venture rather than one person being told what to do by another person who feels more responsible than they ought to be.
If you're a clinician thinking about coming on the programme and want to know what you're going to get out of it, why is this important for you to do, you're probably one of those clinicians who is highly motivated to help your patient. You may well be a clinician who has many patients on your caseload, who have long-term conditions. We're making progress, improving health or improving well-being, improving the person's confidence to manage their own condition. It can feel like very hard work. In a busy clinical setting, the temptation will be to tell people what to do and to tell them how to do it. This is about developing a different way of working with people that will really help them make change and will help them feel more confident about going on to manage their health in a more effective way generally.